and welcome to the show. Thank you for joining us tonight here on Medical Essential Diagnostics Presents the MEDCast. This is a monthly show where we will have first responders, government workers, and other essential workers on to discuss the lives and the careers and the hardships that go along with them. I'll be your host. My name is Eric Zaneski. I am the Director of Digital Media for Medical Essential Diagnostics. We created something called the Save My Life program, which provides physical exams and diagnostic testing services to first responders, government workers, and other essential frontline workers. It's all covered by the insurance, and we provide this as a benefit and a thank you for the service that you do to our communities. Tonight we'll be talking about the American Heart Health Month, as well as National Wear Red Day on February 3rd. Medical Essential Diagnostics has 4 different clinic locations for your convenience, one in Marlton, Morristown, Newark, and proud to announce our Princeton location. Tonight, I am joined by 3 of my most favorite guests. We'll start around the table. Doc, please tell us who you are and what you do.
I'm Dr. Anthony Ciccone. I provide health evaluation and health planning for our patients.
And why did you join the Save My Life program, Doc?
Well, I've been practicing primary care and emergency medicine for about 30 years, and unfortunately, always saw at the end of the spectrum where problems that weren't taken care of in a prompt manner became catastrophes. And I wanted to work for an organization that would allow me to provide comprehensive care and provide an understanding for the patient and for myself so that we could create a 5-year plan and a 10-year plan for success in health.
Thank you so much. That's it's very great to have you on because you are one of the most knowledgeable sources that I know from this program. And like I said, I can't thank you enough for being here tonight, Doc. Thank you.
Thanks for having me.
Our second guest is going to be Battalion Chief Mike Gibbons from the city of Newark. Chief, tell him who you are.
Oh, thanks for having me. And Battalion Chief Mike Gibbons, city of Newark, 30 years on the fire department. Pretty much seen everything. Deal with a lot of firefighters, police officers. And I got involved with the Save My Life program because I am the Save My Life program. So a few years ago, was working out, was competing, fighting MMA, had a couple UFC fighters up in Whippany, and I was competing with some of the best guys in the world, and was getting physical, and my EKG, some of the things would go through if you came to our program, echocardiogram, went through the whole 9 yards, and it ended up being my aortic valve wasn't closing all the way. And I ended up following up on it after competing. Felt great. Never looked great. Was in the best shape of my life. And just was a mechanical issue with one of my valves. And I ended up following up. I ended up going to the Cleveland Clinic. And same thing, went through all the tests that you will get at Medical Essentials Diagnostics. And ended up having my aortic valve repaired. And it was due from impact, which is very unusual. And that was a little over 10 years ago. And my understanding is if it wasn't found through one of those tests, I wouldn't be here today. So essentially, it saved my life.
Chief, your story is such an inspiration to anybody who is a first responder or a frontline worker, and we really appreciate everything you do and having you on here tonight. So,
Great, I appreciate it. No,
thank you so much.
glad to be here.
Our last guest is going to be Chief Conrad Pepperman of the Rockaway Borough Police Department. Chief, tell them a little bit about yourself and your career.
Well, first of all, thank you for having me, Eric. We're here with a great panel tonight between Doc and Chief Mike over here. Thank MED for having us. My name is Conrad Pepperman. I'm Chief in Rockaway Borough, located in Morris County. I've been a police officer now for 26 years, police chief for 6, father of 4 daughters, and I enjoy watching the New York Rangers on my off time, spending time with family, working out.
Nice.
And I think it's a great program. I come from a background of health. My grandmother back in the 70s had one of the first organic daycares in the state of New Jersey.
Mm.
And she always preached to me, as a child, she said that kids are born with three strikes against them. They said the air they breathe, the food they eat, and the water they drink. So I still remember that today, and I think it is true. And in addition to that, my excuse me, my aunt had a health food store for 20 years. So it's important, keeping through supplementation, through diet, and a lot of people never get checked. So I think medical essential diagnostics is the perfect thing from A to Z. I myself went there, Dr. Ciccone, great professional, takes a look at everything, your blood work, and tells you what you're lacking. And I believe the doctor said I was superhuman. His words, not mine. Is that correct, doctor?
That is correct, sir.
Okay, so I want to make sure. And it's a great program.
Again, thank you for everything that you do, Chief. Your service to the community doesn't go unnoticed and is definitely appreciated. So
Thank you. I appreciate that.
thank you for being here tonight.
Thank you.
We'll take a moment to just talk about a event that just occurred with our company, a grand milestone. We introduced a new clinic in the Princeton area, which we had a very successful event for. We had the Mayor of Plainsboro, Mayor Peter Cantu, Deputy Mayor Neil J. Lewis, and Assemblywoman Jaffer and other local officials stopped by for our ribbon cutting ceremony and to take a short clinic tour. Marvin, if you may, please pull up some of the pictures. I just wanted to share this with our audience because I felt like this was a very big milestone in our company's career. Doc, as you know, we started with one clinic in Newark at Silver Lake Hospital. Since then, we've progressed so quickly, and then we created the Morristown clinic, which you're based out of, right?
Yes.
Then in October's time, we created another clinic down South Jersey in Marlton, to sort of expand our reach and provide this service to all first responders and all government and essential workers in the state of New Jersey. It's not an easy task to open 4 clinics in a single year. So we're incredibly proud of what we've accomplished, and it's only going to improve and be much more of a experience from here, right? So thank you for doing that for us, Marvin. Now let's talk about our topic for the day, which is American Heart Month. Doc, as you know, February is American Heart Month,
Yes.
where we focus on the cardiovascular health, and in our audience of first responders and other essential workers. My question to you is, what are some of the ailments that you're finding in regards to heart health and cardiovascular health?
Well, this is a part of life, and it's part of the life of medicine that's very unique. After 2 years of COVID, a lot of people just have not had an interface or interaction with their primaries. So a lot of the issues that we're finding are not only a result of being a human and as we get older, but also just because we haven't seen our doctors and it's becoming more difficult to interact with our providers. But we're finding blood pressures, extremely high blood pressures, because people haven't had it checked in years. We're finding cholesterols that are outside the acceptable range. We're finding plaques of the neck and the legs, which could lead to stroke, which is still at an epidemic. What we're finding is things that were not being monitored and planned for. And that's a patient asked me today, what was the key to all these things that we had discovered in him? And I said the key was that it wasn't picked up 2 to 3 years ago. So we're being more aggressive because of the time in our history in medicine. And we're also being more aggressive because if you look at the numbers, we're not doing well with cardiovascular health in this country. It's still number one killer.
Yeah.
So while there's other priorities, the cardiovascular health of our society has gotten worse. And also with first responders during COVID, the stress that they were under. I do believe the stress has a factor on your blood pressure, your cholesterol, and all these other issues. So stress related is going through the roof, accessibility is going down, and the interface with your providers is very difficult. So we're providing a service to, as I say, let's catch the smoke before it comes fire.
I always love the analogies, Doc. My favorite one is when you go for a vacation and you take your car out, you want to check your oil, you want to make sure all the parts are working and everything. And when you go on a career, like a journey for your career, you want to make sure that you have a stepping stone and a checkpoint to know where you're at and how to improve.
Yeah, because we don't provide a test, we provide an understanding. We don't provide an EKG or an echo. While we do that, we're providing a health plan, just like your financial advisor provides a financial plan, just like a trip advisor provides a trip plan for your vacation. So we're looking to understand your situation, understand you, understand your family history, your environment where you work, your social history, COVID history, your sleep history, so that we have a comprehensive understanding of you.
And I think that's so incredibly important, especially like you said, in today's modern age, when people really haven't gone and seen a doctor since the COVID restrictions and everything. The next thing that I would like to ask Chief Gibbons, what are some of the precautionary measures that firefighters might take, in order to protect their hearts while they're on the job?
Good question. Number one is definitely an annual physical. I mean, you have to be in there. You have to get a in-depth physical. Obviously, diet, exercise. One of the big issues, guys, they're in shape when they come on. 10 years later, they let themselves go. For us, it's a physical job. There's a lot of stress, both physically and mentally. But you gotta stay on top of it. And I think one of the issues, and the doctor brought it up, is people aren't going for their annual physicals, and they haven't gone, especially over the last 3 years because of COVID. And I can see that issue being, number one.
Right.
You could feel good, you could look good, but if you don't get that physical and really look and see what's going on with you, I'm not gonna say you're wasting your time with diet and exercise, but there's guys that diet and exercise and look great. And if you have a mechanical or some kind of physical issue that you don't know about, in some cases, being in great shape is a bad thing for you.
Right.
My issue, and to go back to my issue, because I was working out so hard and I was pushing myself and I was in great shape, I didn't pass out. So I had no warning signs. And number two is with your valves, if you have an issue with your valves, when that blood's being pushed out and coming back in, it's regurgitation.
Yes.
Your heart's growing. So the more you work out, the harder you push yourself, the bigger your heart gets. And a big heart is not a good thing, right, Doc?
No, it's not.
No, it's not. So, to know those mechanical issues, the only way you're going to know is if you go get, an in-depth physical. And that, brings us back to this. And of course, I'm here for this, but, I can't stress enough how important that is. It's almost, you could be running into the wall and you're just not getting anywhere because you should really know what's going on with you internally.
So just a question for you, Chief Gibbons. We work with all types of different first responders, including the state police.
Yep.
And the state police have a trooper wellness program where they're actually required to go get a physical exam every year. Is there anything like that for firefighters, or is it just, an onboarding exam, which would be like the physical?
There's nothing mandatory. This is basically it. Even with the state police, I'm familiar with their physical, and it's not in depth as ours. But if you're going to get a physical, you might as well go do the whole 9 yards.
Yeah.
It seems like something that if you have to do it, you might as well get the most out of it. For the fire department, there's nothing mandatory. And one of the most important things with us is if you do go to the clinic, or your information isn't shared with anyone. It goes to you, doesn't go to anybody else but yourself.
And I know a lot of times when we go and do presentations for the program, people are afraid that, the results might get out to their chief, or it might, their health might be made public or something like
Yeah.
that, and it might have repercussions for them.
Yeah.
But that's never the case
Never
with
the case.
the Save
No.
My Life program.
No. It's a part of the HIPAA laws, and
Right.
you're covered 100%.
And how about you, Chief Pepperman? In your experience, have you had any situations where your officer's cardiovascular health was affected on the job, or?
Yeah, listen, I've been in law enforcement for 26 years. I've seen a lot of people have cardiovascular issues, whether they suffer from strokes. A friend of mine about 6 months ago, unfortunately, died of a sudden heart attack. If I wish he would have went to the medical essential diagnostics program prior. I heard he did not. Could have probably saved his life. And again, in this type of environment, just like Chief Mike said, I'm gonna have to call him Dr. Mike. He's very knowledgeable. Between the stress, your cortisol levels spike between fire and police officers going to certain situations. That's a big factor. Shift work's another big factor. Sleep deprivation. So, when you look at the totality of circumstances with everything that first responders face, and again, I always preach diet and nutrition. And if you're not doing that right, you're hitting fast foods. Like what doctor said, he saw a lot of spike in cholesterol, high blood pressure. And if you go down to any major highway in New Jersey, what do you see in every corner now? You see major drugstore chains, okay?
Fast
you see
food.
fast food chains.
Mhm.
You see convenience stores. So what does that tell you in the American diet?
That we're eating unhealthy and we're not taking the time or the care to really care about our health.
Correct.
What do you think about that, Doc?
Well, I think that, as a culture, as we said before, cardiovascular risk is the number one killer. But I think also what happens is, especially what I've seen taking care of first responders for 30 years, busy schedules, erratic schedules, night schedules, stress that's been astronomical for decades, and over the last 3 years, even more. So I think that we need to be more cognizant, and we're not just doing cardiovascular health. When you come to us, we're evaluating lung function. We used to diagnose 1 to 2 asthmatics a week. Now we do 1 a day. And you're not going to feel shortness of breath because of exposure to fires, because of post-COVID syndrome. We're diagnosing tremendous amount of people with post-COVID syndrome with memory, concentration issues, and chronic fatigue. We're going to be evaluating cholesterol. We're going to be evaluating to see if your anemia, your thyroid, your hormones. We're going to be evaluating circulation of the neck and legs. So I want people to understand that most people, if you went outside of ours, it's thousands of dollars worth of testing at these, what I call them, VIP mills, where people that have means would sign a check and they get the comprehensive evaluation and understanding. So we'll give you both, because I think it's important for our culture to have the healthiest police and fire and sanitation and teachers and EMS, because at the end of the day, who was there during COVID? Police and fire, sanitation. So how do we not provide the best service for the people that were there when we needed them?
Just to touch on what the doctor said, it obviously expands more than cardiovascular. One thing, like I found out myself when I did my blood work, I eat a lot of salads. I take a vitamin D supplement. My vitamin D was still low. So again, it's very important that you mention that, because supplementation also, if you're lacking something, I see a lot of guys at work, they're popping all these vitamins. I'm like, well, how do you know you're deficient in that? You never went and got your blood work. So I suggest for all first responders, get your blood work, see what you're deficient in, or maybe you're not deficient, but at least then you could properly, get it up to the levels with supplementation.
Right.
And we diagnose pre-diabetic and diabetics on a daily basis. So these understandings, we want to catch them early, because we've made a lot of advances in everything from cardiac care to cardiac treatment to blood pressure treatment. But we can't use all this technology if we don't make the diagnosis.
Right.
So give me the time, and when you're there, it's an active process. This is not a kind of office where you're sitting there waiting. You're doing tests, we're getting evaluation, you're being examined. So it's a very active experience, very different than any other experience you have in medicine.
One thing that I'd like to add to that, Doc, we pride ourselves that we have same-week availability for these programs. We like to say that if you call us on a Monday, we can definitely get you in by the end of the week. Is that something that you frequently see in the clinic?
One of the reasons I wanted to work for MED is, for example, last week was a perfect example. There were people calling in, coming to be seen, and we didn't have enough shifts during the week, so we opened up on Saturday.
Wonderful.
We'll make it happen. You call us, we will make it happen. So we saw, 8 comprehensive physicals on Saturday. So we're here for you, because obviously you were there for us.
and I couldn't say it any better myself. Is exactly why we created the Save My Life program. It's to give back to the people who serve our communities. I always like to joke around and I say, we work for you guys, fire, police, EMS, government officials. I've done presentations before where we went to shift changes and presented to officers. I'm from the Princeton area, and I would have to go all the way to Jersey City and to present to these guys. And they also take it very seriously. I remember one situation where I was giving a presentation, and actually the sergeant stepped in after I was done speaking and said, "Guys, you guys remember Joe? I don't remember his last name, but he actually passed away a few months ago from heart complications, and he could have really used a program like this. And this guy is standing here right in front of you guys right now. Listen to what he has to say, because it could be you guys next." You know what I mean? And I just think that this program is so monumental to anybody who works in a high occupation stress position, such as fire and police. Do you have any?
Yeah, absolutely. I've done a few presentations, so
Right.
quite a few, and I think the biggest thing is when you go, no one says, everybody's willing to go. No one says I don't want to go.
Right.
But the biggest problem I see is they don't follow up.
Mhm.
I'm here today. Yeah, why wouldn't I go? It's something that's not going to cost me anything.
Right.
Something that's going to help me, but I got to take 3 hours of my time. I got to show up, and that's pretty minimal. But I see guys just not following up. If you're in a room with 100 guys, 20% might show up. And, that's why we're out here. We're trying to get more people to say, hey, you know what? It's something that's going to benefit you. And
Right.
and one of the big things is the teachers. We're going to schools, we're talking to teachers because they're part of the essential workers. And my wife's a teacher, and she had the program. My daughter is a teacher, and they actually went to see Dr. Ciccone, and they loved it. They would tell me if they didn't. They're pretty honest with me.
I like Dr.
Yeah, they love me. They were great. They were one of the first people to go to Newark, and they loved it. It was a great experience for them. And my wife had a few of the other teachers go down there, and it's something that if it's available, there's not to take advantage of it is unbelievable. But
That's a great point. Chief Mike makes it. It's available to us. We pay health care. Again, it's no out of pocket for, first responders, teachers, public workers. I mean, it's important. You pay for the benefits, get checked. And I tell my guys or all my friends, I said, listen, if you don't want to do it for yourself, do it for your family, do it for your kids.
Yeah,
God forbid that something happened to you and you could have prevented it.
Yep.
Yeah.
And this doesn't replace your primary care doctor and your relationship with them. What this does is augments that. People always said that I will provide you a bank of information and understanding that you follow up with your primary. So we're not looking to replace. We're helping the primary get the essential tools and understanding and test to help him create a plan with you. This doesn't replace your cardiologist, but once again, it augments what he does for you. So this is about working as part of a team. We'll help collaborate with your primary. I call primaries if I feel there's an issue. I spoke to 2 cardiologists on 2 of our patients to get an update and to coordinate a plan with them today. So we're part of a team. We're not replacing anyone. We want to help augment what they're doing.
I think that is such an inspirational thing when people start working for the state, police and firefighters. They get their onboarding exam and then they kind of forget about it. They don't go back to see a doctor or anything. We come directly to the police departments and to the fire stations, tell them what we're about, tell them about the Save My Life program, and we try to make the process most convenient for them, right?
Absolutely.
We have 4 different clinics spread across New Jersey, North and South New Jersey, and as well as Central Jersey. And we also have other programs like the couples program, where you can come in with your spouse and both get seen at the same time. Can you tell us a little bit about that, Doc?
So over the last years, we call it couples therapy. We know that because of our jobs and because of stress, we come home. I'm an ER doc, so our families suffer. We're not home. So obviously they have health issues, and I bring them both in so that way the couple has an understanding, just as if they were going to their accountant and they're lawyers, so that both of them understand each other's health issues if they want to, or individually, and both of them work together as a team to become healthier. And I think it's been a tremendous success. I had 3 couples today.
I had one time at an information session, a guy said, "Hey, is there any way my doctor can fix my broken heart?"
Not sure about that, but I'll give it a shot. But I just think that the couples therapy, individualizing the program, you're not just being put through having an understanding. I want you to understand your health,
Mhm.
just like I want you to understand all the capabilities you have to be a good police and fire. And I think understanding your health is more important than having a test. We give you
Mhm.
understanding. And part of that is obviously what we need to do. And some things that we've coordinated on patients that needed more, we'll help with that.
Yeah. And just touch on what the doc said. I think it's important. Like I know myself when I went through the physical, each technician explained to me, what we're doing, how the machine works. This is what we're looking for, and and, afterwards when you sit down with the doc, very thorough, goes over your blood work from again A to Z,
Mhm.
and again it's a great program. And I really like the tasty snacks when you're done. The granola bars, everything's
They're all healthy.
yeah, all
Chief.
healthy.
They're all healthy.
Low in saturated fats, low in
Yes, they are.
calories.
Yes, they
We,
are.
we got to put a spoiler warning.
No, no, it's true. They're all low fat.
For a program like this, you do have to fast the evening before,
Mhm.
and we don't want you to feel lethargic or anything. So we provide a nice little snack for you guys to.
Afterwards.
Right, correct. And some of the tests that we provide, Doc, maybe you can back me up here. Tests like the stress test, where we have you run on the treadmill. We do vascular ultrasounds, where we look at your arteries and your veins. We understand that these tests aren't your average ordinary tests that you would go see your primary care physician for. It would be more like a specialist, isn't that correct?
So when you go to your primary, you get classically blood work and EKG.
Mm-hmm.
And then you go to cardiologist to get the echo. Then you go to the vascular surgeon, and then you go to the lung doctor to get the pulmonary function. We kind of provide all that. So what we're doing is we're providing comprehensive care. Why? Because once again, understanding is the only way to prevent disaster.
I think the number one cause of death is
Cardiovascular.
cardiovascular, and which is pretty ironic, is if you have an issue with your heart or cardiovascular, a lot of it's preventable.
Yes, it
Pretty
is.
much 99%.
Yes, it is.
If you get to it early. The unfortunate thing is, if you do go down and it's too late, the science isn't there. The science is with you to prevent it, but after you go down, you're back to 30, 40 years ago. So
And
the
the
idea
symptoms
is-
are there.
yeah,
And,
yeah.
and the symptoms are there. So over the last couple of years, obviously after 30 years in the emergency department, I've seen 30, 40, 50-year-old men and women, because cardiovascular disease is not a man. We don't have a monopoly on it.
Mm-hmm.
Women have different symptoms, but they definitely do it.
So
So we're a lot more cognizant of that. And also one of the things that is always, always critical, which most people don't discuss, is their family history. So we help you understand your family history. How did you suffer during COVID or not? What's your lifestyle like? Alcohol, smoking. So those issues, shift work, tremendous stress on the human body. It's
Yep.
it's very stressful. So we kind of, not kind of, I'm sorry. We understand these issues in your life to tailor the approach and to tailor the future for you.
And Chief Pepperman, I always once heard that, officers might get into a situation or something where their heart rate escalates at a moment's notice, and that's not really great for,
The stress level. So, listen, as a police chief, my job is to make sure my guys come home and, ladies at the end of the shift to their families. And like one of the things I did for my department was I gave them steady shifts. They wanted it. And, it's overall benefits their health. Steady days, steady nights. Like you said, now you have to deal with the external factors of the job. So I figured internally that would be good for their health. But yeah, like I said, it's a job like no other, 365, 24, 7 days a year. You're out in all types of weather, dealing all type of stress level. And I believe the average age after retire, don't quote me, it's 4 to 7 years, Doc. I don't know if you know the truth the statistic on that. Yeah, which is very low. And the average person maybe retired, let's say 50, 55. That's on a long life. Scary.
And most people don't really consider these things that aren't necessarily in the forefront.
Mm-hmm.
And I think it's really great that we can all come here together and kind of bring this to light. And people who are watching who are also first responders, educators, government workers. I'm sure that you can relate to everything that's being said here today. Moving forward, we just wanted to talk and touch base on something called National Wear Red Day. Essentially, on February 3rd, they're asking everyone to wear red in order to raise awareness to cardiovascular health. Doc, I know there's a plethora of agencies and organizations that promote something like this, especially cardiovascular health. I was wondering if there was anything else in particular directed towards the cardiovascular health of first responders or government workers that our audience might want to hear a little bit more about.
We kind of came to the forefront in medicine, especially after 9/11, about the stress and from exposure, police, fire, obviously, and all the workers and the long-term effects. So in this culture, post-COVID, and also with the exposure, we're dealing a lot more with those issues, the higher cancer risk, the higher cardiovascular risk, as the chief was saying, from cortisol and stress. So what we're doing, even to a higher level, is having a better understanding. I always go back to understanding. And I always tell my patients, for the time that you could have seen a movie on Netflix, I'll help you figure out your future in a very comprehensive way. So give me the time that you would spend on a movie. Let me help you figure out the future. Let's do this together. Because at the end of the day, during COVID, and I keep bringing back, I worked full time during the whole in the ER, the emergency department. Police came, fire came, the EMS came. We didn't, the world shut down, but we don't. So
Right.
as a result, give us the opportunity. Don't see that movie. Don't binge those two series, and we'll help you. And we want to help you. We want to be there for you. This to me has been a lifelong passion because I've had too many situations where people have died in the emergency department that were totally preventable.
Mm. And I think the next thing that we should go into, promoted by National Wear Red Day, would be the self-care tips for heart health. We'll just take a look at the self-care tips for heart health. Doc, I know you know these probably better than anyone else, right? We have things like getting a full 8 hours worth of rest, eating things that aren't high in sodium. Low sodium diets usually make better for cardiovascular health. Doc, I was wondering if there was anything else that you might like to tell our audience that would be added to this list, self-care tips for heart health.
For self-care health, it always comes down to major factors. Our diet, as the chief was saying, also our BMI, height versus weight, because obviously the average American gains 1 to 2 pounds between 25 and 40. So help people concentrate on that and help people understand things like the 15-hour fast, carbless meals, water intake. The average first responder does not drink enough water because they're busy. And it's cold out. It's 5 degrees out. They're not going to stop and get a bottle of water. So little things that add into a big impact. And that's what it's about. Having you be at your best, because then you'll be taking care of us.
Right. And how about you, Chief Gibbons?
Like I said before, most important is obviously doing that annual physical. But I personally and some of the guys I work with that stayed in shape and stayed on top of it. Obviously, diet's a big thing. We're all going to cheat here and there. You're going to have a pizza. There's just no way around it. But, you gotta, as you get older, it gets a little bit harder. But, every day I do an hour worth of cardio.
Mm-hmm.
I break it up, whatever I have to do, from, getting on a mat to hitting a heavy bag to doing the elliptical to the bike to walking, whatever it takes. My wife too, she stays active, and it's super important for our jobs. Like,
Absolutely, yeah.
I've seen guys come in that aren't in the best shape of their life when they come in, and I've seen more and more of that now. 30 years from now, I can't imagine, where they're going to be. But you got to stay on top of it. Your life depends on it. I mean, we talked about shift work, tours, what we call it, working 24 hours. You get up 2 o'clock in the morning, you're in a dead sleep, and then all of a sudden, you're driving and you see the smoke, and then 2 minutes later you're going upstairs, your heart rate's going from 0 to 140, 150, 160 in 2 minutes.
Wow.
You got to be in shape. The police, 1 minute you're driving, next minute, something happens, you're on a scene and there's some kind of interaction and, you have an incident going, your heart rate's through the roof. So our jobs, you got to be in shape. There's a physical part of our jobs. There's a mental part as you get older. Sometimes when you get older, you compensate because you have some experience. But at the end of the day, it's a physical job. It's a stressful job. And you should want to be at your best. And your life depends on it. It's 100%.
Chief Pepperman, do you have any sort of other self-care tips that you and your men use in order to manage their cardiovascular health? Or
Yeah, well, I promote actually our PBA actually got a membership for all the members to go to the gym, which we utilize. Yeah, which is very nice. So I push the guys, make sure they work out. And they always call me like the food critic. I'll walk around like, don't eat that pizza, have a salad. That's high in cholesterol. That's high in fat. They'll joke. I'm the food police. No, I'm the food police. But just you could look like Tarzan. A guy takes his shirt off, girl takes her, you could, just because someone is in great shape, again, it's what you put into your body. Again, this is not opinion, this is fact. I know because I had a guy worked the same thing, built like Tarzan, shirt off, and back in the day, I remember he'd be eating a whole thing of cookies, cakes, and shakes, and I told him one day, I'm like, that's really not good for you. And all he did was he did one of these, and he pointed at his muscle. I said, I understand that you look good, but internally it's not good for you. So a few years later, he had a stroke. A TIA, correct, Doc? Is that what it is? TIA. But that's when a piece of plaque breaks off in your valve and stops the oxygen to your brain. Is that correct? Sir. Okay. Thank God, 100% recovery. Maybe because he was in good shape. But again, so just when you see someone who's physically fit doesn't necessarily mean they're internally healthy. That's a misconception also. So.
Right.
And February 3rd, we got to wear red. I think, Chief Mike and I are going to have a hard time finding something red being our daughters went to Rutgers. So that'll be an easy one.
I'm the food police in my house. I have 5 daughters. Okay. So between us, we have a softball team. Mm-hmm. We have a softball team. And I'm definitely the food police at home. And one of my biggest quotes is, some of us had a good winter. Some of us, maybe not.
And I always tell people just start today. Let's not worry as much about what we were, how much we weighed 5 years ago and those issues. Just start today. Make the call. Get involved in your health. Don't make it just something that you only see when you're sick, that you go to episodic care, urgent care, whatever. We're always there in terms of that, but we want you to really get ahead of it. We really want you to have a good understanding of what you are and what you need to do.
And I think that goes back to what we like to tell the guys when we do our presentations. Heart health doesn't care how old you are. It can affect anybody at any age. Typically, when we go in and do these presentations, the older guys in the room understand and they listen to us and they know the importance of programs like this. But then sometimes, we have some younger guys who they say, oh, I'm in the best shape of my life. Yeah. Oh, I've never looked so good. I've never felt so good. And then, they have some sort of heart or chest pain that they kind of just push off to the side. Are you finding that when you are in the clinics, people of all ages are coming?
Well, the age is from 20 to 70. Mm-hmm. We've had some retirees also come, which is always great to see. I think age is not indicative of health. Yes, when you're younger, the chance of you being healthier is better. But we have family history. It doesn't care how old you are. We have social history, doesn't care. COVID didn't care. So this is a new world for us now where an understanding, it doesn't care if you're 20, 30, 40. And if you're 20, we have a different program than if you were 70. So,
absolutely.
So the other thing I'd like to touch on with the Medical Essential Diagnostics and Save My Life program is that we actually try to make this program the most convenient for you guys. There's no wait time in between going into testing rooms. Is that right, Doc?
Our average wait is less than 5 minutes to go. And so basically we start at 7:30 in the morning. So we make ourselves convenient. We have Saturday hours. We have the 4 locations. We're engaged. All the staff is engaged in having you. You're not sitting there waiting to go. When you get there, you're going. From the moment you walk in and sign the paperwork till you left, and everyone says that was when really quick. Yes, because you're involved. You're not spending 50% of the
Mhm.
time waiting for someone to say hello to you.
And I hear compared to other programs like ours, the experience is completely different. You know, we do these presentations on a daily basis. We speak to police officers and firefighters like yourselves. And I hear from other programs like ours, you can't even get an appointment for at least a month or two out. With Medical Essential Diagnostics, like I said, you call in on a Monday, we get you in at least by Thursday or Friday that week. Um, in addition to that, we have 3 hours, around 3 hours for the program, Doc.
About 3 hours. And some people are less, some people a little more. But at the bottom line, we have the three A's. We approach things from a 3A. We make ourselves available. We make ourselves affable. We're there. We care. Working for us, we have a different mission than just most offices. And then we're able to help you understand, to help you get an understanding of the future, and to help you also get ready for your next shift.
And I promise you, the doctor will not make you scream or cry. I know a lot of people that's what they're concerned about, like going to the dentist. Oh, it's going to hurt. No, no pain there. There's no pain.
No pain.
And you know, both of you gentlemen did the program yourselves. Would you say that it was an inconvenience for you, or, I mean,
Outside, there's no,
to
no.
to spend
Well,
3 hours once a year to do a program like
When you're
this?
dealing with your life and your future,
I think the doc
spend all day there.
had a great analogy. You know, it's one movie. It's two Netflix,
Shows. Yeah.
shows. It's it's really that not that much time, and if you're engaged, it goes by quick.
And I've gone 18 years in a row.
Wow.
So
Again, and the staff was friendly and everyone's really great there, So,
we're here for you. I
Yeah.
mean, it's been such a horrible time the last couple of years, and it's becoming more difficult to have access. We'll get you access between our three centers. We'll get you evaluated by someone who has 25 to 30 years medical experience with the best equipment, getting you the best outcome.
when I was there for my appointment, I was excited because I think I knew everyone that was there that day, right, Doc?
Yeah,
I knew the whole room. So I'm glad you're looking out for your health. I like that.
but you did actually
Yeah.
know everybody.
Now, if we were curious, how long would it take in order to get your results back?
So the results come in several stages. So the blood work was in 3 to 5 days, the chest X-ray within a week. So usually between 14 days or 10 working days.
And I hear compared to other programs like ours, sometimes it might even take upwards to a month for other programs to get your results back. And they aren't as convenient as you, Doc, where you'll send them right to their primary care physician. Is that correct?
So we do a couple of things that's unique. Every person that I've seen in the past year, I speak to them about their results myself.
Right.
So, and then also we via encryption, we will send you a digital file directly to you. And if you want, which some people do, they want me to talk to their primary cardiologist, I'll call them directly. So I've done all three today. So I met some people face to face who wanted to go over. They didn't feel comfortable on the phone or via a telehealth. And I did half a dozen telehealths today, and as well as call several providers. Once again, we're not replacing who you have in your relationships. We're augmenting it. We're empowering your doctors that you know, that you care, that you have a relationship with to be better. And if you don't have a doctor, we'll help you provide access to primary care within your geographic area.
I think it's such a wonderful program to anybody who is an essential worker to the state of New Jersey. Even we've worked with educators, like you said, Chief
Yep.
Gibbons. We've worked with the NJEA, and we are actually listed under their member benefits booklet. We went down there for Atlantic City for the NJEA convention, and we spoke to over 1,000 educators, administrators, principals, and Board of Ed staff. Is there anybody else that you would recommend this program for, Doc?
The biggest push is going to be the couples. I think that we need to understand each other's health, especially within the household. So couples is critical. I think also the first responders that I'm hoping will come more, but their schedules have been horrible. Paramedics, EMS, they just have done such an amazing job. We would have had millions of people die rather than a million. So I think the EMS people, as well as the couples, the other halves of our lives.
I think the teachers are big. The teachers, my daughter's a teacher also, so I have a kind of little bit of an insight. It's something we've done, even even though it's not. We'd like to see more fire police do it, but over the last 20 years, they have an idea that there's a program out there.
Absolutely.
So they have an idea there's a program out there. The teachers, on the other hand, really have no idea. So this is something that's being introduced to them. One of the things about their benefits and our benefits is we pay into it.
Right.
So they're actually paying for it. So they're in the same boat, and they're not realizing that it's something that's available.
Right.
And if there's one thing we can get across, and if they're watching the podcast, that the fire and police are taking advantage of it a lot more than the teachers.
For sure. Even like DPW workers.
Yeah.
Right.
Yeah.
Town workers.
Yeah.
Municipal workers.
Municipal workers.
We even service the water and sewage departments
There you go.
of multiple towns.
Department of Corrections is also something that this year has gone up, which has been fantastic seeing them for the first time and doing these physicals for almost 30 years. But the teachers definitely underserved. But
Yep.
we're there for them.
The other thing that we've been sort of progressing towards is federal employees, which include active duty service members
Sure.
and veterans. And I don't know if that we touched on this before, but this program also extends to retired police officers and retired firefighters.
Yep.
And family members. That's one thing we miss. Family
Right.
members also.
Right? Family
Everybody.
members. And children above the age of 18. So as we progress with the Save My Life program, I think it's wonderful how we're finding more and more people who could benefit from programs like this. Because before this, the teachers didn't realize that they had services like this available to them.
No, I don't believe they ever been introduced to it before.
Right.
I mean, my wife, a little bit through the fire department,
Mhm.
but she had some other teachers, girlfriends that are like, oh, can I go? And they did show up in
Yes.
Newark, and they loved it. They were surprised that was something that was available to them. So-
You have to get the teachers in the summer of the beach party because we're off in the summer, bring everything in.
Yeah.
That'd be great.
I did a presentation for the National Guard, Army National Guard in Bordentown, and I had a table there. And a gentleman came up to my table and asked me, I have this program where we have to get physical exams done every year. And unfortunately, we have to come to the barracks to get this physical exam done. And it's an all-day ordeal. From what I understood, the gentleman was dissatisfied with it.
Yeah.
And if this was something that the Army National Guard could utilize, I think that we would have such a wide variety of active service and also veterans using our program, which, would be beneficial for everyone, right?
Absolutely.
So,
Everyone could benefit from this, but as the chief was saying, there's certain groups that have not been serviced. The retired police and fire,
mhm,
totally not taking advantage of this opportunity. Teachers, totally not, and also family members.
right. I go to PBAs and I do presentations.
Correct. Yeah.
And, sometimes there's some retired guys there. And they always ask me too, am I covered with this?
Sure.
And I'm so proud to say that you are, because we don't want to forget about all the service that our first responders have done for our community. So,
Sure. Just to clarify, Doc, with family members is 18 and up?
Yes.
Okay.
yeah, 18 and up. That's just the way that it works in the state of New Jersey,
Mhm.
with
That's
the
correct.
insurance. I think that we've had a great talk, guys.
Right. Yep.
We'll kind of start to close it out now. I just wanted to thank each person individually, Doc. I know you're great with the knowledge and expertise when it comes to the medical and the terminology. I always love speaking to you. You're always my favorite doctor. Anytime I ever have any questions regarding health or medical services, I always come to you first. And I just want to tell you how much that I appreciate you, and how much we appreciate you as a company as well.
Thank you. And just also remember, anyone who listens to this, New Jersey has some of the best physicians and hospitals in the country.
Mhm.
We're at the forefront in education, and we are definitely at the forefront of health. Take advantage of that.
I agree.
Thank you so much, Doc, for coming on again. Thank you.
Thank you.
Chief Gibbons, I can't thank you enough either.
Appreciate it.
From
Love being here.
From sharing your story, which I think is such an inspiration to anyone of any age, right? The healthiest guy can sometimes be in a vulnerable situation. And, I think a program like this was something that was like a blessing in disguise, wouldn't you say?
Absolutely. Everything's preventable.
Right.
You can fix pretty much anything.
Right.
The science is on your side.
Right.
Take advantage of it.
And, we always love having you on, Chief. I always love working with you, and you're always one of the first people I always come to
I appreciate it.
for sort of information and spreading the awareness on something like
Yep.
this. So,
Thanks.
again, thank you so much,
Thank
Chief.
you.
Chief Pepperman, the first time we met, I was very curious about hearing about your career and about cardiovascular health in police officers and first responders. I wanted to thank you for coming on tonight. I think that you have an amazing career and a lot of experience to show and tell for. I would love to have everybody back here, whether it be next month or in months in the future from now. Like I said, this is going to be a monthly sort of podcast where we have first responders and government workers on. So Chief Pepperman, I really appreciate you coming on and thank you for sharing your
No
expertise.
problem. Again, I thank you
experience.
for having me. Thank the panel, and again, take advantage of the medical essential diagnostics.
Absolutely.
Do it. Thank you.
Thank you.
Good night.
We will wrap it up here and show some of our upcoming events for the month of February. We have information sessions that we do every single day. We have a whole team of field representatives that come out directly to police departments, fire departments, government departments, state departments, and we are happy to present this information. Our presentations typically take about 5 to 10 minutes. We don't like to waste anybody's time. And we get right to the point. We tell you about the program, the service that we provide to you, and it's covered by your insurance. In the month of February, we'll be going to the New Jersey Police Traffic Officers Association, the Evesham Fire Department, and the Patterson Career Fair, Denville PD and West Windsor PD. We have West Milford PBA, Hudson County Chief of Police Association, and the New Jersey Firemen's Association to wrap it up. In addition to our information sessions, we're also moving into a more digital space where we'll be doing monthly webinars featuring doctors and physicians and technicians. Our first one will be in February. Obviously, the topic would be American Heart Month, and that would be on Wednesday, February 22nd, titled Love Your Heart. It's a free webinar. You can scan the QR code in the link, or we have flyers over our social media pages. Please pre-register for the webinar, and we're really excited to move kind of into this digital space. In addition to that, we have pre-registrations where if you are interested in requesting an appointment, all you would do, you could go to www.medicalessentialdiagnostics.com. There's a button in the top right of the corner there that says request an appointment. If you just fill out that information, we have somebody from our scheduling department reach out to you within 24 hours. I always like to say this is never a commitment or anything. If you do decide to change your mind, we would never hold it against anyone. But we always do advocate for programs like this and to come and get tested. Additionally, you can scan the QR code on the screen here now to go right to that page directly. Or if you wanted to speak to somebody on the phone, you could call 609-865-1107. The last thing we would like to say for the evening is to connect with us on social media accounts. We have a Facebook, an Instagram, a YouTube, and a LinkedIn account. This podcast will be spread to all of those social media pages, as well as we're going to try to get it on Spotify and Apple Music. Like I said, this is going to be a monthly podcast. If you guys know anybody who would be interested in something like this, please reach out to contact@medicalessentialdiagnostics.com. Just one last thank you to everybody here at the table. As we like to say, good night, good fight, right, Chief?
Absolutely.
It's a wrap.
Good
Thank
night,
you.
good
It's a
night.
wrap.
Thank you so much, everyone.
Thank you.